Do you mind taking off your shirt? Is that okay?
Yeah,
Just so
okay.
I want to see everything that's going on here.
Yeah,
Okay.
that's okay.
Can you take off your shirt and stand up and face that way for me?
Yeah.
I could take that.
Okay.
Okay. And then right now, do you feel that 6 out of 10 pain or?
It's getting there. Like right now, it's like maybe a 4. But
Okay.
I think the longer I stand, maybe like 10 more seconds, it'll probably get up a little higher.
Gotcha. Okay. Can you step back for me, please? Perfect. Okay. Now, what I want to see is I want to see you reach down and touch your toes.
Okay.
Okay. And any pain with that?
No, that actually kind of feels a little better.
Feels a little better? Okay, 0 to 10, where would you say that's at?
This probably feels like a 2 right now, like a 1 maybe. Get it to a 1.
1 to 2? Okay. And then just hang out there for a second.
Okay.
Do you feel like your pain is getting worse, or is it just continuing to get better?
I'd say it's getting better.
Better? Okay. All right, good. All right, go ahead and stand back up. Okay, does that hurt when you come back up there?
Coming back up hurts a little bit.
Hurts a little bit more?
Yeah.
Okay, so what I want you to do is I want you to try to tighten up your stomach. So this is called bracing, okay? So what it does is it helps, it's like when you wear a weightlifting belt and then it gives you a little bit more support for your back. So I want to see if we could start activating this muscle, your abs, your core, and then on your way up to see if that makes it feel a little bit better. Okay? So go ahead and touch your toes again. Yep. And if you start bracing here and then come and stand up, does that make it feel better, worse, or the same?
I would say about the same.
Just the same?
Yeah.
Okay, all right, no worries. All right, so next we're gonna start arching our back. This might bring on some of your pain, so I just want you to be aware of that.
Okay.
So your hands go down on your butt, and then I want you to slide it down as you arch back, and I want you to let me know if that brings on your pain or not. That brings on your pain right there? Okay, so maybe your hands get about right here.
Yeah.
Okay, come back up. What would you say that pain was like?
That was like that 5-6.
5, 6 out of 10 pain? Okay, no worries. And then how is it standing now? Does it feel better?
It still hurts. I don't want to say it's a 5-6. Maybe it's like a 5 now.
Okay,
But it still hurts.
Gotcha. So it really seems like arching back is like more painful for you. Okay.
Yeah.
All right, hands by your side, and then go ahead and side bend over towards me. Yep. Any pain there?
No, just kind of feel a little stretch.
Little stretch.
Yeah.
How is your pain? Do you feel that or
No.
nothing?
No.
Okay. And then how about the other way?
Yeah, that one I kind of feel.
Kind of feel that
Yeah,
there?
it feels,
Okay.
yeah.
So maybe like your finger got to about the middle of your knee right
Yeah.
there? Okay. There are some measurements that I just want to be aware of, like how your hands just kind of came here and then down to the side of your leg, because later on when we treat you, we want to try to get you a little bit more range of motion.
Okay.
Because you need range of motion in order to do activities like your golf, right, your rotation, when you're reaching up and cleaning. We need a little bit more range to do those types of things.
Gotcha.
So keeping track of that range is pretty important.
Okay.
Okay, lastly, go ahead and cross your arms. Okay, and then can you rotate over that way? Any pain there?
No, not too much.
Okay, and then go ahead and rotate towards that way.
Yeah, that one hurts a little.
Okay, is that same pain that you're coming in with?
Yeah.
Okay.
Yeah. And actually, now that I think about it, it hurt both ways.
It hurt both
Yeah.
ways?
Yeah.
Okay. And then on a scale of 0 to 10, what would you say the pain is
That
at?
was probably like a 4.
4, both ways?
Yeah, I would say it hurt more going this way.
Okay.
Yeah.
Okay, no worries. Let's go ahead and take a seat. Does that feel a little better? Give you a little rest.
Yeah, sitting down just takes like the pressure off that area.
Good. All right, so I just want to check out the strength in your legs. Just make sure that you have nice, strong legs. Make sure that you're still able to carry out all the activities that you're doing every day. Okay, so go ahead and lift this leg up for me. Just like that. Yep. And then hold it there. I'm going to push down. Try to resist me, but hold it in this position, okay? Okay, ready? And hold, and hold. Okay. And let's check the other side. Yep. And hold, and hold. Any pain with those? Okay. And then go ahead and get the leg straight. Any pain with that? Nope. Okay. Let's bend it a little bit. And then go ahead and kick up. Hold it. Hold. Ooh, super strong.
Nice.
And let's check the other side. Same thing. Any pain with that? Okay. And go ahead and kick up. Kick. Hold. Good.
Okay.
Anything with those?
Nope.
Okay, nice. Let's have you go over to the edge of the table here, and you can sit right here. And what you're going to do is you're going to lift the leg up, and then I'm going to help you go back. Okay. And so one leg's going to hang off the edge, and the other one you're going to hold on to here.
Okay.
This one we're going to see, I want to see if we're going to, I want to see the length of the muscles here in the front.
Okay.
Okay?
Okay.
So go ahead and hug that. Yep. And let's have you lay back. Sorry, it's a little cold. Okay, you feel okay? All right, so let me come right here. All right, you just hold that right there, okay? Well, when I let this go here, any pain?
No, not too much.
Not too much? Okay. All right, so relax. Okay. Yep, that's here. Okay, any pain with any of those? Okay, good. And let's switch sides. Okay. And if I let this go, any pain with that?
No, just a little stretch in the front.
Just a little stretch, nothing in the back?
No.
Okay, good. And then let me go ahead and get this straight. Okay. And how about that?
That feels okay.
That feels okay? Okay, good. Okay, I'm gonna let this leg hang. We're gonna sit up on 3. 1, 2, and 3. Whew. All right, you feel okay?
Yeah.
All right, let's have you lay back on your back with the head way over there, please.
So lay on my back?
Correct. So you mentioned lifting was also a thing. So I want to check out your hamstring length because sometimes if that's tight, that can help. That can hinder your mechanics of your lifting.
Okay.
So I just want to check out your length there. Okay. All right. And really quick, it was the right side, right?
Yes.
Okay. Perfect. Okay. So I always want to check the uninvolved side first. So I'm going to lift the leg up. Check out your hamstring length. Okay. Any pain there? Nope. Okay. Let me get this here. Anything here? Just a little stretch. Okay, good. Okay, let's check this side. Okay, relax. Anything here?
No.
Just a stretch.
Yeah, it's getting there.
Getting there? Okay, any pain in the back?
No pain in the back.
Okay. I just want to crank this up. You might feel more stretch here, and then let me know if that feels, if that brings on any of your symptoms in your back.
No, I just feel more of a stretch.
More of a stretch. Okay, great, great. That's awesome. Okay, good. Let's have you turn around, please. We can put this, the hole. Oh, sorry. Get this for you. All right. There you go. Comfortable? All right. Okay, so I'm just gonna be feeling your back, okay, and then you let me know if you feel any of your symptoms, all right?
Okay.
All right, so it's your, I always forget, so your right side, so of course I wanna check out your left side first, duh. All right, so I'm just feeling your muscles here. Is it painful on this side at all?
No.
Okay, and then going up, how does that feel?
Feels okay.
Okay, and then if I touch over on this side, any pain there?
No pain. Maybe a little tender, but no pain.
Okay, and then if I go up here, anything there?
No, that feels okay.
Okay, good. Okay, so now what I'm gonna do is I'm gonna push on your back. I'm gonna be pushing on your spines, but don't be alarmed there.
Okay.
And I just wanna see if that brings on any of your symptoms, okay?
Okay.
All right. All right. Okay, anything, let me get this table a little bit lower. Woo. Okay. Okay. Anything here?
Nope.
Or here?
Nope.
No? Okay.
Press it on me.
Okay, good. Okay, going up. Anything here?
Nope.
Or here?
Nope.
Okay, good.
You're doing central?
Yeah.
Okay.
Anything here?
No, just feel like pressure.
Okay. Or here?
Just pressure.
Pressure, okay. Anything here?
No.
Or here?
Pressure.
Pressure, okay. And then one more. How about here?
Pressure.
And here.
And yeah.
Okay. I do want to check some of the mobility of your spine up into the thoracic region. Just let me know if it brings on any pain, but I'm going to kind of move quickly, okay?
Okay.
Okay. Any pain?
No.
Okay. Any pain?
No.
Okay, a little stiff here. Any pain?
Pressure.
Yeah, okay, good. Any pain?
No.
And how about here? Okay, good. All right, now I'm going to be checking kind of the same thing, the joints in your spine, but I'm going to be checking the individual ones on the side of the spine, okay? All right, I'll check your uninvolved side first. Anything here?
No.
Okay, and how about here? Okay, and here? And here? And one more.
No.
Okay, good. Let's check out your other side. Okay, so this one might bring on some of your pain, okay? So just let me know if one feels more than the other.
Okay.
All right? All right. Anything here?
A little bit of pressure.
A little bit. Is that pressure or pain?
I think more pressure.
Pressure, okay. And how about here?
Yeah, that one feels more like pain.
That one, is that kind of the pain that you're coming in with today?
Yeah.
Okay.
Yeah.
All right. And then I'm going to go up a couple more, okay? How about here?
Yeah, that one's more pain.
More painful? Would you say that's more painful than the other one?
Yeah.
Okay. Okay. And how about this one?
That one's a little less. That one's just pressure.
Not as much? Okay. All right. And then how about here?
That one's just pressure.
Just pressure as well. Okay. All right. Good. Good. All right. Last thing, what I want you to do is, can you slide towards the edge of the table so your feet are on the ground and your hips are right on the corner here? Yeah, just like that. Yeah, yeah. All right. So now that area that I was poking on, I'm going to put my hand on there, and I'm going to ask you to activate the muscles in your back. All right? And then I'm going to poke again, and you let me know if that makes it feel better, worse, or the same.
Okay.
Okay? All right, you can grab higher up on the table, like a Superman. Yeah, yeah. All right, so you were feeling pain around like the L4, L3 region. We said L3 was really painful. Okay, so I'm going to press there.
Yeah.
Is that the pain right there?
Yeah.
Okay, all right. So I'm just going to keep my fingers there. Can you lift your legs up? Okay, any pain with that first off when you start activating the muscles?
Nope.
Nope? Okay. And if I press down, does that make it feel better, worse, or the same?
I think the same.
The same, still painful? Yeah. Okay, all right. And relax. Okay. All right, go ahead and sit up for me.
Okay.
And you can sit back down on the chair.
Okay.
Okay, so here's what I think is going on with you. So I think that the joints in your spine, where the spine from like one level to the next, they articulate or they touch each other, right? Just like how regular joints work, like the elbow, you have the arm bone and the forearm bones that they come together, right? So that particular joint in your spine is called the facet joint. I think that's a little bit aggravated.
Okay.
And the reason being is because those joints, when they close down, that's when you start having your pain. And then when they open up, it feels better.
Okay.
So for example, when you stand for a long time, your back is extending and that closes down the joint.
Okay.
Okay? So that's why you feel a lot of pain when you stand up.
Okay.
All right?
Okay.
When you sit down, it opens up.
Gotcha.
It kind of opens up that joint so you feel better. Now, sometimes with facet joints, when you start walking, because you get a little bit of mobility, it feels better.
Okay.
Okay, because you get a little bit of more fluid in there, and the joint's able to move a little bit better.
That's why walking and sitting feel better.
Correct,
Okay.
exactly. But when you extend, that hurts a lot. When you side bend over to that same side, you're closing it down as well.
Gotcha.
But when you side bend the other way, it feels a lot better.
Okay.
Right?
Okay.
And one of the biggest tests that really told me about that is when you were on the table face down, and I was pushing you hard, right? Especially on that one specific area, you're like,
Yeah.
But then everywhere else, it didn't really feel any pain. So that's why, that's how we know that the facet joint is definitely involved.
Okay. Okay.
Okay. You do have some other impairments, that is what we call it. I don't like to say issues, but I guess we'll just call it impairments that we can always work on. That might help you get a little bit more, like your thoracic spine was a little bit more stiff.
Gotcha.
Right? And then when you get a little bit more motion here, now when you're lifting up, if this is stiff, that's kind of hard, right?
Yeah.
But let's say this is more mobile,
Yeah.
then you can move more there versus always hinging
At
the lower back.
Okay.
Exactly,
Okay.
exactly. So I'm going to give you two variations of an exercise that you can do at home to help you out.
Okay.
But first off, I'm gonna treat you with the same thing that made you feel a little, that made it hurt a little bit,
Okay.
because that will actually, it's kind of like, it kind of is stuck, and then if we work on moving it a little bit more, I think it might feel a little bit better.
Okay.
Okay?
Okay.
So I'll help you out with that treatment, and I'll give you an exercise to kind of mimic that to make it, to help you move better as
Okay.
well. Okay?
Okay.
All right, now, can I have you just stand up really quick?
Yeah.
All right, and then go ahead and bring your arch back for me.
Oh yeah.
You still feel that same pain? Okay, same, like, what would you rate that as? I think you
like
said
a
6, 5,
five,
6,
yeah.
5, 6,
Yeah,
okay.
Still the same.
Okay, all right. Let's have you go ahead and lay on your stomach for me. All right.